doctor.
Your heart needs to be strong to keep up. Flora, for a strong heart today.
Hello and welcome to the show. In South Africa, on average, every day, 150 people will have a heart attack. And in most cases, it's the first symptom of heart disease those people will experience, and all too often, it's fatal. At that point, it's too late to say, if only. You know, if only I'd stopped smoking, if only I'd done a little more exercise and lost a little more weight, if only I checked my blood pressure, my blood sugar and cholesterol and did something about it then. If only I'd eaten a little healthier. Tell you what, if you promise never to say, if only, I'll promise never to say, I told you so. If you want to live to a ripe, old, healthy and happy age, it starts now with making the right lifestyle choices, especially when it comes to your heart. Of course, not everyone's going to take that advice to heart, though, so when the day comes when their heart attacks them and you're there to see it, you also can't say, I told you so. You need to give them a second chance, and here's how you do it. The most common cause of death from a heart attack in adults is a disturbance in the electrical rhythm of the heart. It's called ventricular fibrillation. Instead of pumping rhythmically and powerfully as our hearts normally do, the heart muscle fibrillates or shakes like wobbling jelly and stops blood supply to the brain and other vital organs. The best way to treat a ventricular fibrillation is by applying an electrical shock to the chest with a procedure called defibrillation. And the sooner you do it, the better. In fact, for every minute that defibrillation is delayed for whatever reason, the chances of resuscitation drop by almost 10%, which means that after 10 minutes, the chances of resuscitating a victim of cardiac arrest are near zero. One way of buying time before a defibrillator arrives is by doing CPR, chest compressions. That way, you keep oxygenated blood flowing to the heart and brain. However, defibrillation is the only effective way to resuscitate a victim of ventricular fib. In fact, survival rates for individuals with ventricular fibrillation treated by defib are 5 times higher compared to basic CPR. That's where these units come in. AEDs, we call them, automated external defibrillators. You'll find them in all sorts of public places, airports, schools, gyms. They're there and they've been designed to be used by anyone, and they're safe to use. There are no reports of AEDs harming users, bystanders, and no reports of them delivering inappropriate shocks to victims. So the question is, how do you use them? You see them, do you really know what to do? Regardless of which brand of AED is used, the only knowledge required to operate it is this: to press the on button. That's all.
Remove clothes from patient's chest.
Okay, at this point I'm not the patient, otherwise I'd have to remove my clothes. But it really is as simple as that.
When chest is bare, open grey plastic case and peel off white adhesive pads.
So in other words, if you can follow instructions, you can use an AED.
Remove clothes from patient's chest.
All right, we get that point. Let's turn this off for now, and let's go and speak to Graeme Richards, who's in studio, who's actually going to pretend to be our dummy. Not dummy is probably the wrong word to use, Graeme.
We don't have to pretend too hard for that, but Michael, great to see you, man.
You've actually resuscitated a number of people in your life before.
Yeah, but in some sort of weird twist of events, I've been there, present at these moments, and it's, you know, it's something that catches you by surprise. But I think in our line of work, you're so used to just kind of getting on with the job and thankfully, having worked with doctors such as yourselves over the years, picked up a tip or two. And I've had 2 cases that were successful, and one sadly that wasn't because the heart attack was so severe. But just being able to chat with that man's son and let him know that someone was trying, it really did make a big difference. But it is something that can happen to any of us at any time, exactly. And you need to be able to act.
And the basics, although you can't sort of take what we do here and say, I now can do CPR, but the basics really are chest compressions. And if you can do that, you can save a life. Exactly. Graeme, I'm going to ask you to pretend to actually have a heart attack, to collapse, and we're going to go through the whole process of what to do, particularly with an AED. And you'll be glad to know, ladies, that that button, when you press it, does say remove the patient's clothes. We are going to have to do that. Graeme, you okay with that?
That's right. And it says it in quite an authoritative tone as well. It's
do it now. Do it now.
Now. Yeah. You know? Now, I have to say, you know, I first worked with Michael when I was 19 years old, okay? Terrified. You were, what, about 21, 20 at the time? And I remember thinking, I'm working with this hero of the South African screen, and it was on Miss SA, and I was so terrified, and you were a lifesaver that day. Right. So I've come full circle. You're again saving my life. So I feel like I'm in safe hands.
Graeme, you're going to make me blush. crush.
I hope, mate.
Yes, you will. Well, let's see. Let's see if this works. Okay, so Graeme collapses, all right? It's not often that you'll witness this, but imagine you do, and Graeme goes down, all right? Imagine you fell a little more that way, Graeme, yes. As one would, you know. And he doesn't have a sort of a mic pack on him. So what do you do in this instance, all right? Someone's gone down. Remember the 3 H's, all right? The first H is hazards. You do not want to start a resus in the middle of a highway or in the middle of a violent strike, so make sure there are no hazards around you. The second H is, can you hear me? Get some sort of reaction from the patient. Can you hear me? And if there's no reaction, then you start onto the, I guess, third H, which is call for help. Now, when you're looking for a reaction in the patient, you're looking for breathing as well. We used to talk about look, listen, and feel. It's really basic to see if a patient is breathing or not. If he's not, the third H is call for help. And just make it obvious. I need some help. Someone has gone down. At this point, if there's someone with an AED nearby, grab that AED, but don't stop or don't not initiate CPR until that AED comes. So the first thing you want to do while someone is bringing the AED, thank you, JC, I'll do that now, is you start chest compressions. You just literally press the chest, the bottom half of the sternum with your elbows locked and your weight over the body, and you just go for it. 1 and 2 and 3, 30 compressions, 2 breaths. Do you want me to kiss you now? No,
please,
no, don't do that, you know. What I really want to get to is our AEDs, all right? So you've done that, and someone hands you an automated external defibrillator. This is how it works. It's very simple. Open it up, take the unit out, and as I said earlier, you press the green button. Simple, boom. And listen for what it says.
Apply pads to patient's bare chest.
Bare chest.
Pads connector next to flashing light.
All right, there we go. So we're going to open the chest up. Graeme, I hope you shaved. Fantastic. Graeme is shaved. There we go. What do you think, ladies? Hey, fairly impressive. This is why we asked Graeme to do it, and, you know, and not Liesel, possibly. All right, so here are the pads. First, apply the pads to the patient's chest, and this is where you're going to apply them. And again, it's very obvious. The pads actually show you exactly where to apply on the chest. All right, so that pad is going to go right there.
It's quite an insistent voice, eh?
It is, yes. It's making me nervous, you know. Hurry up! And the second pad goes right over there. You can see where that is, just below the right nipple, the left nipple rather. So there it is. All right, once you've applied the pads, you'll then plug it in. Don't plug it in before you've applied the pads.
So it shows you exactly where to place them.
Analyzing heart rhythm.
Okay, so it's all automated. The moment it's analyzing Graeme's rhythm, okay? Not touching the patient. The patient shouldn't be moving. All right.
Shock advised.
Okay, did you hear that? So the automated external defibrillator says, we need to shock this patient. It's charging.
Patient. Deliver shock now.
Okay, so now you need to press a button to deliver shock. Make sure no one, including yourself, is touching the patient. And you hit the shock button. Graeme, you're ready. This might hurt a little bit.
Good.
Okay, obviously there was no electric shock going through Graeme, you know. Aren't you glad? A little bit nervous there for a moment.
Nervous there, I won't lie,
Is this going to shock me? You know. And you can hear that's Graeme's heart rhythm. Not really. I mean, this is a training manual. But once you've delivered the shock, you carry on with CPR for another 2 minutes. 30 compressions, 2 breaths. Do that for 2 minutes, and you'll start again until such time as the AED says there is normal rhythm in the patient's chest, then you stop. Or until the ambulance personnel arrives, they take over, you explain exactly what happened, and you hand over to them. So, Graeme, thanks for being our man on the ground, mate. Really appreciate that.
It's a pleasure. Thanks for saving my life,
yeah,
Doc.
Anytime, you know. Listen, when last did you go and see a dermatologist, mate?
You know, it's only because we have this personal relationship. It's been a while. It's the Cape Town sun, okay? That's my defense.
I'll tell you why. South Africa has the second highest incidence of skin cancer in the world after Australia. So more than most countries, we need to be especially vigilant and respectful of the sun, particularly before the age of 20, when Graeme and I first met, when we were most at risk for developing malignant melanoma.
Your heart needs to be strong to keep up. Flora, for a strong heart today.
I want to live the best life.